Hi class, my name is Katie Kessner and I interviewed a health educator named Vicki. Vicki's taught health and science courses in Alaska for 8 years now and in Oregon for 2. In Ketchikan, all students had to take a semester of health and physical education. Therefore, she got to see and teach every student in the school. She taught courses on mental health, human sexuality, nutrition, fitness, and drug education in Oregon. She has her bachelor's degree in health education. And she stated that Alaska was different from Oregon. In Alaska, you're only required to take personal health and fitness courses in high school, but in Oregon, you're required to take human sexuality and mental health courses as well. Challenges that she faced were having to cover issues in her classroom that were controversial. They can be feared to students because they have no idea what they're about to learn in these courses. She offered alternative classes for students with parents that did not want their children in the courses, although she only experienced this challenge with 2 families out of the 10 years that she's been working. She began teaching when AIDS first became known. That was an interesting part of her career. A lot of fear of the unknown was prevalent in her classes. She had 2 students that had AIDS at the time. Also, in her human sexuality course, she taught the parents of a student took their son out and accused her of teaching pornography when she was really teaching anatomy of the reproductive system. Later, she found out that the mother that was just scared of the teacher finding out that she was sexually abusing her son. She found out many things that she had to report during her years of working. Sometimes she felt like she became an interventionist to help students find services that were struggling with addictions, anorexia, or sexual abuse. Some career advice she gave was for living in Alaska, it wasn't a great job to have. She's experienced budget cuts, and sometimes money in this area of work is the first to go. It's a challenging job to get because there aren't many of them, but she says it's a great and rewarding job. She recommends one to get certified in health education and science or another major. She said dual certifications are better. So Vicki had some experience with using the theories and models we've been learning. She said that a lot of people have no idea of the important health issues that are prevalent. So she said awareness is most important and then application. Addictions and unsafe sexual behaviors that she dealt with, Vicki felt morally obligated to help with the intervention. She would get resources for students and agencies involved for treatment and counseling. The health belief model, the most commonly used in health education, is one that she used for sex ed in her classes. So if students felt the negative behavior or condition can be avoided, in this example, AIDS or HIV when she was teaching. Also, if they have a positive expectation that by taking the recommended action, they will avoid the negative health condition. For example, using condoms will be an effective choice to prevent this disease. And also believing that they can be successful when they take the recommended health action. Therefore, when they use condoms comfortably and confidently, they will prevent their chances of getting HIV. These behaviors and beliefs are positive and safe. That was a lot of the times she used this in her teaching of sex ed. Also, she stated that she used the trans-theoretical model for primary prevention in HIV, STD, and pregnancy prevention in adolescents in her human sexuality and sexual education classes in Oregon. Also, she used the model in promoting physical activity in her fitness classes both in Ketchikan and in Oregon. And to determine the best ways to educate her students, raise consciousness, and promote change, these theories she stated were great to use for those 3 important factors. Overall, this assignment helped me better understand what health educators do and to know that these theories and models that we're currently learning are prevalent today. Thanks for listening and have a great day.